Hi, my name's Jenny. I'm a community midwife in Brighton. I'm going to do a really short video on coping strategies that you might want to use during your birthing journey. I'm going to separate it into two parts, home and in hospital. So we're going to start at home first of all. So when you start getting some of the sensations, you may be getting backache, low period type pain, paracetamol, really, really good. So no more than 8 in 24 hours. Along with that, you might consider a nice warm bath. So what do we do at the end of the day when we're aching? We have a nice soak in the bath, help relax the muscles. You might want to consider your environment as well. So nice low lighting, music, some food, some fluid. When you do come into hospital, you can bring in LED lights, you can bring in your own music. Don't forget your snacks, it's really, really important. Your body's going to need lots of energy to birth, and we will be encouraging you to eat and drink. No, it sounds really weird, but breathe. So when we're in discomfort, we hold our breath, we breathe much more shallow, don't get in as much oxygen. So nice, deep, slow, steady breaths gets in lots of oxygen that will pass through to the baby and help it to deal with the labour. You might have a birthing ball at home. We have these in hospital as well. So these are really, really good to get you into a supported squat. So it will also help your body kind of go in a circular action, rock backwards and forwards or side to side, allows the baby to rotate. So what happens? You guys, your cervix will dilate, the baby will rotate. This movement will help the baby do that, manoeuvre its way through the bony parts of the pelvis to be able to be born. Don't know whether you've got a tennis ball at home, but tennis ball really, really good for rolling up the spine, across the shoulders. Also right at the very bottom, your sacrum, your coccyx. You guys will feel quite a lot of pressure right at the bottom as that baby comes down through the pelvis. Whether it's gentle, whether it's firmer, you guys will be able to tell your birthing partner how hard you want that sensation on your lower back. You might hire a TENS machine. So the way this works, it blocks the pain sensation to your brain. Also encourages your body to produce its own pain relief hormones called endorphins. Creates a very gentle sensation on the skin. What you have to remember is when you take it off, you must turn it off, otherwise somebody's going to get a little bit of a shock. Some of you guys may already be practicing things like meditation, other forms of relaxation like yoga or Pilates. Some of you may be doing hypnobirthing already. So hypnobirthing is a form of self-hypnosis and relaxation. It helps you to prepare physically, mentally and spiritually for the birth, and helps you manage the anxiety around expectation of pain during the birthing process as well. They also work on positive affirmations. So for example, I give birth calmly and gently. These you need to practice. So if you do something often enough, your body will respond positively to that affirmation. So practice, practice, practice. You might consider a pool. So you might have hired a pool for your home birth. In hospital, we have one of these. So the idea around a pool is literally you're submerged right to the top here. The weight of the water makes your body float, takes a lot of the weight of the pregnant belly, allows you to move freely. It's nice and warm, it's like a really big bath. Partners can get in, midwives don't. You can use things like paracetamol, massage, the ball. You might want to use entonox in the pool as well. Going on to entonox, which is a form of mild anaesthetic. So it's nitrous oxide and oxygen. You breathe it in through this mouthpiece. It's important that you do deep, slow, steady breaths to be able to get it into your system. So this won't get rid of the sensation completely. It relaxes you just to be able to ride the sensations a little bit better. When you're in hospital, you might consider pathogen, which is an injection that you have in your bum cheek or your leg. It's an opioid, it's a strong pain relief, relaxes you, makes you feel very drowsy. It can also go through to the baby, so it makes the baby drowsy as well. It takes about 20 minutes to start working. You can have them about every 4 hours or so. You may consider an epidural. So an epidural is a continual dose of local anaesthetic into the epidural space in your back. This is administered through a very, very fine tube that stays in your back. This keeps going until you've had your baby and will last for a couple of hours after you've given birth as well. Now, you'll be having somebody to support you during this journey. So your partner is really, really important. So whoever that may be, they'll be there to support you, whisper sweet nothings in your ear, maybe doing the massage, using the tennis ball, words of encouragement, getting you into lots of different positions. We will be encouraging you to get up, mobile, moving around. So that's the strategies that you might want to use. I'm going to show you some websites that you're going to find really, really useful. But just remember, birthing, you got this. Thank you.